Welcome to part 1 of Top 15 Common Medicines You Should Know. We'll simplify the names, doses, mechanisms, and uses of essential medications. First up is paracetamol, also known as Crocin or Calpol. Doses range from 500 to 650 milligrams every 6 hours, with a max of 4 grams per day. It inhibits prostaglandin synthesis, reducing pain and fever. Used for fever, mild to moderate pain and headaches, but be aware that an overdose can cause severe liver damage. Next is ibuprofen, known as Brufen or Ibugesic. The dose is 400 milligrams every 6 to 8 hours, with a maximum of 1,200 to 1,600 milligrams daily. This NSAID inhibits COX enzymes to reduce inflammation and pain, and it's used for various pains, inflammation, muscle strains, and arthritis. A word of caution: avoid if you have gastric ulcers. Number 3 is amoxicillin, sold as Amoxil or Mox. The typical dose is 500 milligrams every 8 hours for 5 to 7 days. It works by inhibiting bacterial cell wall synthesis. It's prescribed for bacterial infections in the throat, ear, urinary tract, and respiratory system. Remember to complete the full course to prevent antibiotic resistance. Fourth, we have azithromycin, known as Azithrol or Zithromax. The dose is 500 milligrams once daily for 3 to 5 days. It inhibits bacterial protein synthesis and is used for respiratory, typhoid, and skin infections. For best absorption, take it 1 hour before or 2 hours after food. Coming in at number 5 is cetirizine, found as Cetine or Ococet. The dose is 10 milligrams once daily. It blocks H1 histamine receptors, effectively reducing allergy symptoms such as allergic rhinitis, itching, sneezing, and hives. Be aware it may cause mild drowsiness, so avoid driving if affected. Number 6 is pantoprazole, known as Pantacid or Proterra. The dose is 40 milligrams once daily before breakfast. This proton pump inhibitor suppresses stomach acid secretion, treating acidity, ulcers, and GERD. Note that long-term use may lead to vitamin B12 deficiency. 7th on our list is metformin, sold as Glycomet or Glucophage. The dose is 500 to 850 milligrams twice daily with meals. It decreases liver glucose production and improves insulin sensitivity, making it crucial for type 2 diabetes management. Take it with food to avoid gastric discomfort. 8th, we have amlodipine, found as Amlong or Stamlo. The dose is 5 to 10 milligrams once daily. This calcium channel blocker relaxes blood vessels, treating hypertension and angina. A common side effect to note is mild ankle swelling, also known as edema. Number 9 is atorvastatin, known as Lipitor or Tonact. The dose is 10 to 40 milligrams once daily at night. It inhibits HMG-CoA reductase, lowering cholesterol production and preventing heart disease. Avoid alcohol and check liver function regularly. 10th is losartan, available as Losar or Rupace. The dose is 50 milligrams once daily. This angiotensin II receptor blocker causes vasodilation, useful for hypertension and heart failure. It is strictly to be avoided during pregnancy. Next, we have diclofenac, known as Voveron or Dynapar. The dose is 50 milligrams twice daily after food. This NSAID strongly inhibits prostaglandin synthesis, providing relief for severe pain, arthritis, sprains, and post-injury pain. Avoid prolonged use due to the high risk of gastric irritation. Number 12 is ondansetron, found as Emacet or Ondam. The dose is 4 to 8 milligrams before meals or chemotherapy. It's a 5-HT3 receptor blocker that prevents nausea signals to the brain, effectively treating vomiting, post-operative nausea, and chemotherapy-induced nausea. It's generally well tolerated with few side effects. 13th is salbutamol, available as Astelin or Ventolin. The dose is 2 puffs every 4 to 6 hours as needed via an inhaler. This beta-2 agonist rapidly relaxes airway smooth muscles, used for asthma attacks, bronchospasm, and COPD. Overuse may cause temporary tremors or palpitations. Our 14th common medicine is the paracetamol plus ibuprofen combo, examples being Combiflam and Ibupar. This combination offers both fever-reducing and strong anti-inflammatory action. It's used for high fever with body pain, cold, flu, and intense headaches. Do not take with other painkillers, and regularly check liver function if using long-term. Thank you for watching PharmaXene. Stay tuned for part 2 of our common medicines video.